Great, just letting everyone know that I started the recording,
Right away.
and Nick, you can go ahead and take it away.
Great, thank you. All right, so I'm going to start with a few motivating factors for this initiative. The first being that the Delaware libraries have a strong history of programming and partnerships, specifically assisting patrons with basic needs. So this really started after the 2008 financial crisis, and we were opening job centers in several libraries throughout the state to get people back to work. A few years later, with a collaboration with our Department of Health and Social Services, we started deploying social workers in several libraries. And we were seeing the need for people not only to have access to talk about jobs, but also looking at signing up with health insurance, finding food assistance, housing, etc. So really, moving into telehealth was sort of a next logical step and experiment for us as a library system. This is not news to anybody on this call, but public libraries are a common space for some of the most underserved members of the community. At the Delaware libraries, we are constantly seeing people come in experiencing a number of varying situations, experiencing homelessness, mental health, behavioral health issues, being a veteran, immigrants, the elderly, and the list goes on. But we also see more closely in Delaware, and this is data from our Department of Health and Social Services. In the years between 2012 and 2017, we saw depression rates increase 33% in the state, and drug overdose rates just increase well over 100%. We couple that with a lack of access to healthcare, looking at geography and limited provider bandwidth. I have this picture here of the state of Delaware and the federally qualified health centers. And I put this purple box here because this is where the pilot for our kiosk, our telehealth kiosk program is. And you can see that there's really one federally qualified health center in that area. And I have a few additional quotes here. One from the University of Delaware that said, in 2018, there were 815 individual primary care physicians practicing in Delaware, and that's down 5.4% since 2013. And then the Kaiser Family Foundation saying that 19% of mental health needs are met in Delaware. Oh.
The problem it currently faces.
That 19% of mental health needs are met in Delaware, about 8% lower than the national average. We also see here that so libraries are universally valued for accessing health information, and I didn't realize how strongly the community felt this. This is a Pew Research poll in 2015 that showed 87% of respondents to this particular poll affirm that libraries are at least somewhat useful in seeking healthcare information. And then also looking at access to internet and technology, because that plays directly into access to healthcare.
Hey, there's Nick.
Oh. If I could just ask everybody to mute themselves when they enter, please. Looking at access to internet and technology in Delaware, about 10% of Delaware residents do not own a computing device, and about 16% of Delaware households do not have broadband internet. And these percentages are actually higher in Sussex County, which is the lower, most rural part of our state, where the telehealth kiosk program was piloted. We're almost at the end of my motivation slides here. But as it relates to COVID and libraries reopening, I found this interesting from the similar Pew Research poll. Libraries are a valuable asset to the community and they need to stay open. In fact, when you look at the Hispanic population, 78% of Hispanics say closing their library would have a major impact on their community. 72% of women said something similar, and 70% of those ages 50 or older said closing the library would have a major impact. So referencing back to the people that we are serving in the community and trying to impact with this project, these three demographics in particular show that they value their library to be open, and that plays into this entire project. So the question that I posed to really launch this project was, how can we continue to couple emerging technology, such as telehealth, with public library infrastructure to serve the basic needs of our patrons? And this is the first part of it, are these booths for social service. I call them telehealth booths, but we're also calling them teleservice booths because we're not only seeing patrons want to access telehealth inside, so we're seeing people use it for legal appointments, job interviews, resume prep, etc. They're soundproof and can fit 2 to 3 people inside and are connected to the high-speed internet that already exists in our public libraries. Really what I call the secret sauce to this program are what we
Yes, unless I'm adding anything. That's what.
are our navigators. And these are the staff that we've hired to be situated directly next to the kiosk. And they're really there to help patrons with all parts of the kiosk process. This includes making appointments, wraparound support. So maybe they need to get signed up with Medicaid or her health insurance before they go in and have a behavioral health or primary care appointment. Looking at food assistance, jobs, they really are there to assist patrons through all part of the kiosk process. A lot of our navigators have a social work background, which is even more helpful in terms of case management. And like I said, these kiosks are currently in 3 rural libraries in the southern part of Delaware. Because this is grant funded and because I am an engineer by training, I'm really interested in data and the surveys we can collect in deploying these projects. So in the case of these social service booths, we're able to track and collect data before somebody books an appointment and after that. And we're asking questions about what they're here for. Have they had access to a behavioral health specialist before? And then after the fact, how was that experience? Was it better than previous means of seeking behavioral health support or just various forms of legal employment support? And I have some interesting data to share at the end of the presentation about what we found. And then lastly, I add here that this isn't possible without partnerships, and I'll go into some of those later, but in particular, the ChristianaCare Health System is our largest healthcare provider in the state, and they've launched since COVID a Center for Virtual Health, which is really going to be key in working with more of these distributed centers of healthcare, such as the telehealth kiosks. So I wanted to dive a little bit deeper about what these kiosks look like. I was very particular in what vendor we went with at the Delaware libraries. These kiosks, we added extra white noise, sort of a retrofit white noise machine on the doors for added privacy. We have a hand sanitizing station for people, for patrons to use before and after use. These particular kiosks have UV sanitation inside, which completely sterilizes the interior for about 11 minutes post-use. And then we keep it really simple with technology. There's an iPad inside that is loaded with social service apps. So in addition to some standard telehealth or teleconferencing platforms like Zoom, Skype, that providers are using, we're also looking at things like Amwell, which is a telehealth specific platform, Teledoc, things related to behavioral health like BetterHelp and Talkspace. And I can go into more details if people have questions about those. But the second part, and this really isn't as groundbreaking in terms of libraries doing this because it's been done for years now, is device loaning. But we really wanted to pair it with our teleservice deployment. So we deployed hundreds of Chromebooks and Wi-Fi hotspots to all of our libraries statewide. These can be loaned out for a week at a time and up to 1 month total, assuming there's no wait list. There are no late fees, but we do enforce replacement costs for lost or stolen items. These do come with all necessary charging cables and a carrying case. We have a specific landing page that we created for this program that links people back to social services in the state of Delaware in the case that they're at their home and have questions about food assistance, Medicaid, etc. And there's a sticker on all of our devices that links people to that landing page. So that's sort of our tie-in to the social service aspect and the telehealth piece. Similar to the kiosk, we do have surveys because we want to know, is this people's first time accessing the internet? Do they have reliable internet in their house? Do they have a computing device? So we can sort of cross-reference with that data that I was sharing in the beginning, what the Department of Health and Social Services was seeing in our state. So in terms of getting access to telehealth or any of the other teleservices, there are really 3 ways. The first is obviously to visit the local library and talk to those kiosk navigators who I was referring to earlier. And they're currently located in the 3 pilot sites. The second would be we equipped each navigator with their own cell phone. So patrons during hours of operation can call the navigator directly to book an appointment. And then lastly, this is the URL for the new landing page, www.getconnected.delawarelibraries.org. And that not only has a plethora of information about social services in Delaware, but they can also book an appointment in the kiosk, book time with a social worker virtually, an employment specialist, and so on. And I should note here that a Delaware library card is required for all services. We want people to not only to use these services in the library, but to also look at a variety of other things that are offered in the public library. And so far, we've seen about 50% of people using the service have signed up for a library card to use it. This is a little preview of the landing page that we created. Again, you can directly reserve a Chromebook or Wi-Fi hotspot, book time in our telehealth kiosk, make meetings with social workers, employment specialists. I wanted to point out here on the top right, well, not only does this directly link you to get a library card, but we also have made this landing page translatable. And in Delaware, the three most predominant languages are English, Spanish, and Haitian Creole. So all of our marketing, our website is translated into those three languages. So I'm first going to talk about expected outcomes of the program, and then I'll talk about what we have found so far. The first and most obvious is increase in access to remote health and human services via these distributed kiosks, but also through the Chromebooks and Wi-Fi hotspots. And that pairs with the access to tech devices and Wi-Fi through the device loaning initiative. We also see, and this is inherent to telehealth, a decreased lead time to see a healthcare provider. And we're able to track that by asking patrons after they use our services, qualitatively, was this a better experience? Did you see somebody faster than you would have historically when you're seeking out healthcare? The increase in technology, knowledge, and education. What I mean there is there's a lot of technology that arose during COVID or came to the forefront that people were sort of forced to learn. And that includes, like we're on right now, Zoom and other teleconferencing platforms, but it also includes things like contactless payment. It includes things like Instacart and DoorDash. And as a library system, that's what we feel we can train people in terms of new technologies that are coming about that were not here pre-COVID. And the last part is really the increase in the impact of the library to the community during COVID-19. And we're really going to expect to see that in terms of new library card registrations and foot traffic in the door. And we're seeing that people are definitely signing up for library cards to use these services. So what have we found? We have found, though, that the library foot traffic has slowed in general. And I'm actually out here right now in Reno, Nevada at the Rural Library Summit. And this is something I'm talking about with people constantly is that, yes, library foot traffic has slowed. So because of that, we have to experiment with new marketing tactics, not only just from libraries being reopened, but how do we market these new services to the community? What I am finding in the data right now is most people are actually hearing about the devices and the kiosks at the library. So yes, we have some social media and some radio advertisements, but it's really the staff at the library, it's our navigators who are selling the program. So it's my goal and my team's goal to continue equipping staff to explain the services, explain the full extent of services and what can be offered to attract more people to come into the library. We're seeing that digital literacy is low. And one of the things that the Delaware libraries are doing to combat this is deploying North Star Digital Literacy, which is a achievement-based platform to equip people with the skills, a variety of digital literacy skills. And like I mentioned before, education on emerging technology platforms. This includes things like mHealth, which is another telehealth platform, contactless payment, Zoom, Instacart, etc. What we're seeing so far is an uneven distribution of demographics using the services. We see primarily people who identify English as their first language using the services, about 90+%. In terms of the kiosks, by the telehealth kiosks. That's about 70-30 men, male, female using the kiosks. The devices are the reverse. We see more women coming into using and learning out the Chromebooks and Wi-Fi hotspots than men. So what this tells us, particularly when we're looking at the ethnic demographics, is we need to do a better job about grassroots marketing to the community. So when I talk about the Spanish speaking and the Creole speaking members of our community, what kind of grassroots marketing can we deploy? We're now going to places of worship, churches, synagogues, et cetera, to talk about the program. We're going to community leaders because I've identified that word of mouth is really how people are hearing about this, and community events. So a couple of weeks ago, we were at the Hispanic Festival in Georgetown, Delaware, which attracted well over 20,000 people. And we were talking about the telehealth program to them. We are seeing a wide variety of kiosk uses, and that was expected with the program. So not only telehealth, but legal, employment, et cetera. And because of that, I'm really focused on partnerships to provide this wraparound support. So not only working with our public health, our healthcare systems, our insurance providers, but talking to legal clinics, talking to Department of Labor and other nonprofit organizations that can support that. We're also seeing a lot of people use the devices for entertainment. We're not restricting people what they intend to use it for. So it's what I'm really interested in is, can we combine entertainment but also have an educational component to it? So can we teach people about digital literacy or about healthcare and make it entertaining? We are seeing more people use the devices in the kiosk. What that tells me is that maybe more people are interested in taking out a device and bringing it home and taking care of whatever their social service need is in the comfort of their home. So how can we equip patrons with the knowledge to access all of those services from the comfort of their home? And we can do that through things like mHealth, which is a telehealth platform, but also healthcare system partnerships where providers can contact people directly through a library Chromebook from the comfort of their home. So I wanted to leave with some final thoughts. It looks like we have about 10 minutes left, and I'll leave some time for questions. The first is, breaking the mental health stigma is difficult, even for public libraries. I went into this thinking that, libraries are a stigma-free zone where people are coming in from all parts of the community to access internet literacy, digital literacy, but we're still seeing this gap in people wanting to access health support, specifically mental health support, for the first time. It's also about changing the public library's perception about library and library services. I feel like I'm constantly trying to tell people that libraries are no longer just about books, and we are hubs of resources for the community, and we reflect what the community needs. I mentioned this in the last slide, but accessing health and social services are moving to the home. So if the libraries, as we are providing Chromebooks and Wi-Fi hotspots, we're seeing those more heavily used and taken back to patrons' homes. Partnerships are key for the success of really this and any initiative. Our library staff and managers are stretched thin as is, particularly during the pandemic. So relying on partnerships with our public-private support is important. And I really sum up my team's key to success in these three words is adaptability, empathy, and creativity. Even if we weren't in a pandemic, I think things going back to these three words is really key to an innovative program like this. So I wanted to give a quick snapshot of where we're at and where we're going. Right now, again, we have 3 libraries as identified in these 3 flags here. We have 2 navigators. We have about 600 Chromebooks and Wi-Fi hotspots, and we've raised about $750,000 to launch this program. So this program at its full capacity can work with about 34,000 patrons annually. But with the support of our Congresswoman and additional grants, we are planning to scale this up to 10 additional libraries, so 13 total across the state next year. We'll be hiring 5 additional navigators, purchasing additional Wi-Fi hotspots, and raising additional money to support this. And at that capacity, we'll be able to serve about 55,000 patrons annually. So I have this here because, again, the libraries aren't doing this alone. We have support from our healthcare system, insurance providers, local nonprofits, from schools. And I would be remiss if I didn't mention the 3 participating libraries in this initiative: Laurel Public Library, Milford Public Library, and Seaford Public Library. They are the ones that are launching our kiosk initiative. And then lastly, I want to thank our funders. It really takes innovative funders to support an innovative project like this. And without their support, we wouldn't be where we're at today. So with that, I would like to close, and we have about 7 or 8 minutes for questions, and I'm happy to take them. Okay, let me start going through them here. So Pamela asks, privacy is critical in using these. Is this new? I never heard of these. So they are soundproof. That is inherent to the privacy. They also have the kiosks have a frosted door, and they are locked. So, you know, in terms of people getting into the kiosk when it's not being used, we lock the kiosk when it's not in use. We have them in more private parts of the library. So even when the navigator is talking to a patron, their conversations are staying secure. And then in terms of the platforms themselves, like Zoom and Skype, they are now, for the most part, HIPAA compliant. So when people are using telehealth appointments, the platforms are all being very secure in terms of privacy information. What vendor, Lori asks, what vendor do you use to buy your kiosks from? So we use a company called TalkBox. I'll put that here in the chat. They are out of Colorado. Let me try that one more time. TalkBox. They are out of Colorado. They are a smaller company and have been great to work with. Just to give you a few ideas, we recognized that there was a small lip at the entrance to the kiosk, and we asked them to manufacture a wheelchair ramp for us to make it ADA accessible. We've worked with them in terms of creating a new locking mechanism, so we're not having people get into the kiosk when it's not in use. So they've been a great partner. Charlie asks, have we had issues with people booking these for inappropriate uses? There's really no opportunity to do so because of our staff that are at the kiosk. So they're there right before they're going in there to use it, and right after. They're trained, to be aware, but we haven't had any incidents yet. I see a Delaware person. Pam from Bear, Delaware asks, how did the idea of the kiosk come about in Delaware? Was it modeled after same kiosks used in other states? Yes and no. So kiosks, yes, but not in public libraries. I was seeing, and my team was seeing, some instances of kiosks used in supermarkets, some in Delaware, but there was the public supermarket chain in Florida was partnering with the healthcare system to do kiosks. And I thought, well, that could be interesting to do in public libraries because, we see people, members of the community that might not be accessing healthcare otherwise. I've also seen it in airports and some other informal environments. Rebecca asks, can you give us an idea of how big a team and how many staff involved in getting this pilot up and running? So I am really the main full-time person leading this project. I have the support of an additional 5 to 7 people as members of the Delaware Library's inspiration space team, or the social innovation team. But I also rely on the support from the library managers. We meet bi-weekly to talk about the program, and then I meet weekly with our navigator. So formally, there's a team of maybe 5 or so. Informally, or maybe the broader group is a team of close to 24 people. Lori asks, how much use have you had? How many appointments per week? So it depends because the kiosks hours of operation change in each library. I say right now we're at about a 15% utilization rate, which is not as high as I would obviously like it to be, but it's also means that we're seeing, 15% people using it who maybe not have had access before. What we're seeing a lot of though is people are sometimes just talking to the navigators outside the kiosk, and that doesn't always translate to a kiosk visit. So yes, we're still helping the patrons, but maybe they don't need to use the iPad or the virtual visit. We're seeing that being 100% time people are talking to our navigators. Any other questions? All right, so with that, I'm going to put my email in the chat in case people have follow-up questions. But I appreciate everybody joining me today for this presentation, and enjoy the rest of your conference.